Drug prohibition is killing us. Overdose deaths, overcrowded prisons, disproportionate persecution of minorities. It's time for a new drug policy that takes into account harm reduction rather than criminalization. In 2020, over 1,700 people died from opioid overdoses in BC, making it the deadliest year in British Columbia's history. 2021 is on pace to top that morbid record. The criminal law is a hammer, a very effective tool that society must wield carefully. We should not view drug use as a nail to apply the hammer to. To continue to do so would waste tax dollars on enforcement, incarceration, and unjustly deprive users of their livelihood and freedoms. Prohibition pushes users, already suffering from addiction, towards unsafe compounds cut with toxic and deadly substances. Every policy has unintended consequences. The criminalization of drugs has led to overdoses, an illicit market, increased gang violence, and over-policing of minorities. In 2019, over 30,000 Canadians were arrested for simple drug possession without intent to traffic. Criminalization increases the burden on our justice system, which would better serve society by focusing on violent and otherwise dangerous crime prevention and prosecution. The Public Prosecution Service of Canada recently changed their approach to simple possession offences in August 2020, when Director Kathleen Roussel asked prosecutors to seek charges in only the most serious cases. The City of Vancouver has also sent a preliminary application to Health Canada for a Vancouver model for managing substance use and saving lives through decriminalization. It's clear that Canada is waking up to the harms caused by prohibition and is interested in exploring a sensible drug policy that focuses on harm prevention rather than criminalization. Some questions and concerns linger. Among them, would legalization of drugs lead to increased use? Would there be a greater or less burden on our healthcare system? Would, drug offenses aside, would crime decrease? For example, drug-related crimes like theft or gang violence. For an effective policy, we really have to start with the why. What is the negative externality of drugs that we want to minimize? Medical, judicial, and social science researchers have settled on three broad categories of harm: social, physical, and addictiveness. As you can see from the figure, alcohol ranks quite high comparatively in all three categories, yet we tolerate it as a society and accept its use within limits. Certain other ones that are lower, we still criminalize to the same severity as the highest ones, cocaine and heroin. Now, we need something smarter that makes sense and is rational. Prohibition will never prevent all drug use. History proves this. In the 1930s, prohibition simply funneled the trade of alcohol into the hands of the mob, and we're doing the same thing today. There will always be a level of drug use in society, and we need to accept this, tailor our response to discourage it, and treat addiction and its underlying causes rather than put people in boxes. Many claimed that marijuana was a gateway drug, and undoubtedly so when it was equally as illegal as cocaine, heroin, or methamphetamine. Now that it's regulated and controlled, like alcohol, this signals to potential users that there's a rational and logical purpose behind increased control of more harmful substances and regulation of less harmful substances. Discussing healthcare, we're already setting records for overdose deaths. Supplies are becoming more toxic and unpredictable, and continued criminalization will only exacerbate the problem. What we need is a safe supply. Having an addiction should no longer make one a criminal. Doing bad things while on drugs should still be illegal. Theft while on drugs, driving while impaired, anything else that's illegal otherwise under the criminal code should still be illegal. Drug crimes are disproportionately applied to racialized persons at every stage of the criminal process, from policing to prosecution to sentencing. Ending prohibition would be a significant step forward to a fairer justice system that is more equal for all. In conclusion, what we need is a smarter drug policy focused on harm reduction rather than applying the criminal law to an area where it is very inappropriate.